Hello, hello. Good evening, good evening, good evening. This is Clement here. Welcome to our coffee talk on Wednesday evening at 8:30 p.m. As you all know, we do coffee talk every week, 8:30 p.m. Wednesday evening. So please join us. I mean, I would like to tell everybody welcome, welcome. So today is a beautiful, beautiful Wednesday. Okay. So thanks for joining us. As you can see, today's coffee talk, I mean, every week we talk about different things. We talk about different matters. Some can be matters that is close to your heart. Some can be about life planning. So today we have a very special topic and a very special guest. All right. Today we will be talking, the topic that we will be discussing or we will be doing our coffee talk will be your child's skin matters. So, what is this whole topic about? All right, what is this whole topic about? When a person has a medical concern, right, they usually turn to a doctor for help, right? So, there are many types of doctors, and a person's specific problem will usually determine what type of doctor do they attend to, or do they see, or do they seek consultation, right? So, we are always concerned for our family, and of course, our family's well being. So what more? Our children. Being a parent, like for me, I'm a parent as well. Being a parent, you can see this side, my daughter, my son's pictures all behind me. So being a parent is always sometimes it's like everything also put them first. Everything, from the food they eat to their well-being to if little things happen, it's like wow, my daughter, what happened? What happened? My son, what happened? What happened? Suddenly, daddy, mommy become like you know, not in the world anymore. So that's why men, when you love your children, remember show your wife appreciation also. Okay, this one is say wrong a little bit from what we're saying. Okay, so today specifically, we will be talking about our child's well-being, our children's well-being, health and skincare. So basically, when our child is ill, we consult a pediatrician. And when our child has skin complications, who do we consult? Right? When our child is ill, not feeling well, pediatrician. So when they have skin problems or we say skin complication, we sometimes say, yo, what happened? Some parents will think, is this eczema? What is wrong with their skin? So who do we consult? We consult a pediatric dermatologist. All right. So for your information, in Malaysia, there are less than 10 pediatric dermatologists in Malaysia. There are less than 10 of them. And of course, tonight we are honored to have one of the pediatric dermatologists here with us. Of course, not me. Later, I will invite, okay? Right. So, pediatric dermatology, they provide comprehensive care to infants, children, and adolescents with skin, hair, and nail conditions. So Janji, it's, any skin, hair, nail condition, any condition at all, right? Then we go and see a pediatric dermatologist. So they can range from different complications, we would say, right? It can be eczema or viral rashes or to more complex systematic disorders involving the skin. So because children they are prone. I mean, not all children are not. We are not saying that children must be like that, but children sometimes they are prone to skin problems like rashes, eczema, and allergies because of their nature also, lah, right? I mean, eczema we will find out more actually how and why and all these kind of questions we will answer all of them. But because also I think children they like to play, they like to touch different things. Speaking of which, just now during dinner we were boiling something, and my son nicely want to touch the pot. Thank goodness his reflex is very fast. He touched, then as much as we eagle eye them, these are the things kids will do. Like kids will be kids, lah, right? Yeah. So often it's hard for parents to distinguish between what is a minor problem or something that really needs urgent or immediate attention when it comes to, skin complication or allergies and everything, right? So today we have, like I said, today we have someone special. She's a pediatrician. She is also a pediatric dermatologist and PDs. I mean, I call it short form lah, PDs lah. We have less than 10 in Malaysia. So today is a very, very special day where actually we invite um, this speaker or this doctor, to come on air with us so that those who are watching, if you have any questions, please feel free to answer. Please feel free to ask. And she, of course, will feel free to answer. It's not every day you can get to see a pediatric dermatologist, right? Unless you pay for it, of course. But well, you are getting some free advice as well as, if you have any questions or concerns, yeah, you can address them tonight. All right. So without further ado, let me introduce you to Dr. Jenny Tan. All right. Hi, Jenny.
Hi, Clement.
Yeah. Hi. How are you tonight?
Good, good. Have you
Good.
have your dinner?
Yes, I had my dinner, and my son nearly burned his finger.
Oh dear. Is he
Yeah,
okay?
yeah, it's okay lah. I mean, his reflex was quite fast. He did like that. Then after that, he's like, but after that, give him some
Oh,
ice cubes, then it's okay. Yeah,
okay,
but
okay.
watch him all the time, but still sometimes they are faster than we think they are lah.
Yeah, lah, yeah. Kids are very fast. Just that split second, you didn't
Yeah,
watch them, something will happen.
yeah. So how are you tonight? Great, great. You also makan already?
Yes, yes, I had my dinner. Yeah,
Mm.
a bit tired from the work, but I'm happy. Thank you for inviting me. I'm happy to join you all tonight.
Yep, yep. I'm glad you made time to come on board because I mean, of course, every week we talk about different topics, but I mean, the more we go on doing coffee talk, all these videos will be archived in our, of course, in our Kingdom Group Facebook page, and then I can see that a lot of people are picking up all these videos. Even some people they cannot watch it live tonight or right now. A lot of people are going to our Facebook page and picking up all these videos and sharing and everything. So it's very, very good so that
Oh, that's nice.
whatever yeah, so that
That's
whatever
nice.
topic that they need, and especially like tonight, you know I told our audience here that our guest is Dr. Jenny Tan, pediatrician and pediatric dermatologist. So less than 10 in Malaysia. So anybody who is here want to ask anything, better ask because tonight is free. Tomorrow you go to her clinic, yeah, you have to pay for it. Right?
Clement.
So I mean, just a little bit about yourself, lah. Would you mind just sharing a little bit about yourself first before we go into like maybe some of the topics you want to talk about? Where are you now? Yeah.
Yeah. Hi, all. I'm Dr. Jenny Tan. I'm the consultant pediatrician and pediatric dermatology in Subang Jaya Medical Center at Subang Jaya. I had my undergraduate training from University of Malaya, and then I specialized in pediatric and got my postgraduate training from Royal College of Pediatric and Child Health UK. Subsequently,
Mm,
I further subspecialized into this field, pediatric dermatologist, as
mm,
Clement earlier mentioned. It's still a niche in Malaysia. There are not many of us in Malaysia, probably less than 10. Um, and however, I find this very interesting, so I subspecialize in this. Um, and so here I am to answer your question.
yeah. So I mean, it's because I mean specializing in pediatric dermatologist is also something like you said is very niche, right? So that is why you chose to do it, is it? Or you find that because not many people are doing this and there may be a lot of people who need all this advice, that's why you did it.
No, well, when I finish as a pediatrician, I find that a lot of the skin conditions, skin rash look the same. And it intrigued me, I wanted to find out how actually, to really know how to differentiate all these rashes that look the same once upon a time. And of course, I have my SIFU. who was my mentor, and I was inspired by him. Then he was a very clever guy that every time when we show him a skin rash, he can just easily say, okay, this is that and this is this. So I'm amazed how can he do it, and I wanted to be like him. So then that's why I joined the field to be with him, to become his colleague and learn from him, and to become a bit derm.
Yeah. So that means you all call yourself Pixdom, not like I said PD, not PD.
Bit derm.
It's really
PD
Pixdom,
sounds like not decent.
Okay, Pixdom. Yeah, because yeah, like you say, lor, maybe because you're also intrigued, right? Because like you say, once upon a time, all the rash is, to a parent, right? Like I'm a parent. If it's a rash, means it's a rash, and then everybody just say rash, 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 but they are actually categorized differently. They are actually different things, right? I think once you specialize in all this, then you realize, oh, actually it's like this, it's actually like this, it's actually like that.
Yes, that's right. Suddenly, your eyes open up. You able to differentiate. Oh, this is infection. This is eczema. So it's very interesting.
Yeah, yeah, very, very interesting. Okay, so I mean, let's continue a little bit. So, what are the more common skin problems that children in Malaysia face? Based on what you do every day. When parents bring their children to come and consult you to see what are the more common skin problems that children in Malaysia face.
Well, majority of my patients that come and see me face are patient with eczema, unfortunately.
Oh,
So statistic has shown actually 2 out of 10 children have some form of eczema. So actually, it's quite common, and therefore, a lot of the patient that I see has this eczema problem. So other
mm,
skin condition that I see will be like skin infection. I also have children that come in with birthmark. So most of the birthmark are, you know, mm, are benign and doesn't need treatment, but there are certain
mm.
birthmark that requires treatment. So these are the one that you need to pick up and advise the parents accordingly. And teenager usually come in with acne problem. They want to get their acne solved. And other thing will be like pigment disorder, vascular problem. Problem with the blood vessels causing patches on the skin.
Oh,
Uh, yeah,
there are
and
so many
some.
things now. I mean, yeah, listening to you say all these things, is like there are so many other things nowadays, right? It's not like last time, it's like that means like that, no, that one thing. But like you mentioned, eczema is really a more common problem nowadays, is it?
Yes, yes. Do you know that especially during this pandemic over the last 2 years, I'm seeing more and
Mm-hmm.
more of eczema, especially eczema involving the hands, because people are using all sorts of hand sanitizers, 70% alcohol, and all this for sensitive skin, definitely it will trigger the eczema.
Yeah, yeah, because of the need for sanitizer lah, because everybody is worried about COVID, sanitize,
Exactly.
sanitize, sanitize. And children's skin definitely is also more sensitive, right? Because they are younger, and then if they
That's
really
right.
need to use so much of all these things, I mean, don't talk about children, like even my wife's skin also, my wife's hand also start peeling already. So what more children, right?
That's right. That's right. That's why I'm seeing so much more, hand eczema or contact dermatitis, because using all sorts of, not only they are using hand sanitizer nowadays, they are using the sanitizing gun, and a lot of other form of sanitizer.
Mm,
So for
mm, mm,
sensitive
mm.
skin, this definitely will spells trouble.
Mm. So okay, I know this is a more generic question now, right? So like I mean, because I have this thought that when should parents bring their children to the wisdom? Can parents treat their child at home for some common problems? Okay, but of course the common problem can be so many things. Okay, for example, let's start with diaper rash lah. Okay, let's
Mm,
start with diaper rash lah. So
mm.
for example, diaper rash, if it's just a little bit here and there, some parents will just say, okay lah, never mind, I buy cream lah, because now they Google a lot. They Google, okay, this cream, they go and buy, they go and apply. So should we actually do that, or do you think it's advisable?
Okay, so for common condition like diaper rash, of course, not all parents with diaper rash should run to the pits derm, right?
Yes.
It's a simple thing, it's a common thing, especially for not a first time parents. They will be very confident in handling. So for such a case like this, I would not, say, oh, you must visit a pits derm to get your child treated. No, if let's say for simple condition like that, I do advocate you try the usual measures, and treat your child. But however, if let's say your usual treatment doesn't see any improvement, I do advise to bring to see a pit, because for all maybe the rash that you see that you thought is just a simple diaper rash, maybe some other things.
Yeah, yeah. So we think it's diaper rash lah. So when it gets a little bit worse, then we think like, this diaper rash, spread a little bit already. But actually, it can be other matters lah, other complications lah. So
Yes,
the earlier we
the
find out what it is, the better lah, right? So the earlier we find out what it is, then the better lah.
Definitely so, because commonly diaper rash will be complicated by secondary infection. For example, fungal infection, that area is always moist, fungals, yeast will like to sit at that area. So secondary fungal infection or even yeast infection, for example, candida, will not respond to your usual treatment of, diaper rash treatment. You need additional treatment, and I would advise to get it early, because a lot of time, those patients that come in for so-called diaper rash but has already secondary infection come in usually very late. The whole buttock is all angry looking, red. The child is screaming in pain. So I pity the child. They should have seek the treatment earlier, because the child doesn't need to go through all this suffering.
Yeah, but then that means really there are some parents who, when they come in, the child is really like is really bad, really one.
Yes, yes.
I think if for me, right, if the diaper rash is just a little bit bigger, I also start panicking already. I mean, it's like, it's
Yeah.
worrying.
Well, our parents, there are some like so then they bring in very early, a little bit of redness. They will bring in already to seek early treatment. But they are the other extreme that are more, well, it's okay, let's wait and see. And more so now with the pandemic, actually a lot of people are afraid to bring their child to seek treatment, because they're afraid of the virus. So then by the time they come is very bad already. Yeah,
Yeah, yeah. So maybe they will just put off bringing the child. They say, wait lah, COVID virus, afraid. So they just put it
exactly.
off, put it off, put it off until it's like,
Yes.
oh my goodness, we really have
Yeah.
to
So they
go
will
already.
try whatever they can, in order not to
Mm.
bring to the hospital.
Yeah, so it's so worrying. Yeah, so I can see that Ken is here. Jasper, hi everybody. Hi, we have Dr. Jenny Tan here. Okay, Faiza or Shirley says hi too. And then yeah, Winnie, and then we have Ijun. Ijun, he asked, got voucher discount or not for your consultation in future? Because I think Ijun said he's coming to see you tomorrow, right?
Oh yeah. I'll see you then.
Yeah, and then okay, Kevin, I saw your question on eczema, but we will come to that, because we are talking about diaper rash now. So I think what about then diaper rash generally is that lah. So what about cradle cap?
Okay. Cradle cap
Hmm.
is another common condition in younger baby, usually baby less
Hmm.
than 6 months. That is because of the baby still have the mom's hormone in their body. So the mom's hormone in the
Okay.
baby's body will stimulate all these hyper production of sebaceous gland. That's why when there is this hypersebaceous gland secretion, so all these you will find all these scales on the scalp of the baby. And in more severe case, you can find that even the eyebrow behind the ears is affected. So what is classical
Eyebrow
is,
also.
yeah, it can affect some. The mild one will only affect the scalp, but more severe one, they can affect the eyebrow, behind the ears, sometimes even the neck, the armpit. So those are the more severe one. Yeah. So then the classical thing is they typically have these very yellow scales, very thick yellow greasy scales. So that is cradle cap. So cradle cap, the good
Oh.
news is usually the baby will outgrow it. As they grow more than 6 months, when the mom's hormone in the body getting lower and lower and reduce, this condition will get better by itself. But of course, you will say, "Yeah, not nice to see lah. Grandparents complaining already. Anything can be done or not?" So of course, yes, there is something that can be done. Okay, so those that is at the scalp one, you can actually put some olive oil half an hour before the child go for bathing to soak the
Oh.
scales to soften the scales. So then when they during the bath time, you just take a comb, gently comb out the scales. But you don't go and
Oh.
by force try to
Aku
spread it
lah.
out. No, you
Ah.
just gently comb. Whatever that come out, come out. Whatever that don't come out, repeat the same step the next day. So after
Ah.
a period of time, all these scales will come off slowly. And for the
Hmm.
severe one, sometimes I do put a little bit of treatment, the anti-inflammatory cream. For example, those that not only affect the scalp, but also affect the eyebrow, the ears, the neck, the armpit. Those are the more severe one where I will put in some anti-inflammatory cream. Of course, moisturizer will
Hmm.
definitely help a lot.
But must be children must be for children lah, the moisturizer, right? Cannot
So,
be any
yeah,
moisturizer that.
you are right. You are right. So there are so many moisturizer out there. For those with cradle cap, seborrheic dermatitis, the other name is seborrheic dermatitis, I will advise them to
Hmm.
use a gentle moisturizer, the moisturizer that is designed for sensitive skin. Because some of these
Hmm.
baby with cradle cap, we don't know. Some of them, especially those with family history of, the parents has some sort of sensitivity, they will progress,
Hmm.
they will evolve to develop eczema. Okay. So
Oh,
eczema
okay,
is
okay.
another disease. Yeah. So they start with cradle cap, they may evolve to be eczema, especially those with parents, one or both parents that have some sort of allergy.
Mm, mm, mm,
Mm.
mm, mm. Wow, so it's like, I mean, for to do wisdom also not easy. There's so many things to remember. You see, like every time when we are talking also, everything we talk about, then your some compartment in your mind will come up with the answer. Or really, it's not easy.
No
But
lah, these are my bread and butter.
yeah, but I think practice makes perfect also lah, right? Because you've been through this, and then so when every day when you see different kind of patient, then it trigger different part of the brain. Then once you get the feel of it, and then it's like a common normal thing for you lah, right?
That's right. That's right. Yeah.
Okay. Yeah, then of course coming to our next, I think one of the condition that a lot of people will be interested, and like you said is very common, Jenny, is eczema, lor, right? Is eczema, lor.
Mm.
So and
Yeah.
actually, I mean, because we already have questions here, but do you want to just talk a little bit about eczema first before maybe we can just see some of their questions here?
Yeah, sure. So yeah, eczema
Mm.
is definitely my bread and butter. Most of my patients that come in has some
Oh.
form of eczema. Yeah. In fact, those that have
Mm.
mild eczema, sometimes the parents actually don't even realize that their child is having eczema until that when I point out that, hey, your child's skin, has some form of sensitive skin, then only the parents realize. Yeah. So is that common that
Sometimes
sometimes,
sorry,
hmm,
sometimes they don't even realize, is it?
yeah,
That means
because
it's very mild, or Or
It's
maybe
it's
it's because
mild,
as parents we just don't know how to see. Or maybe it's just
maybe.
that we don't know how to see. Hmm.
Well, so they thought,
Okay.
that is part of normal, some relative child, some cousins also have similar dry skin, similar a bit of rash here and there. So they thought it's normal. Everyone will have it. Yeah. So, and they didn't bother to, seek treatment for that. Mm. So
Hmm.
eczema is one condition that actually, according to study, it showed that eczema actually can be very debilitating. It can impact the quality of life of a child. And more so, can you imagine a child less than 1 year old? They can't even complain. All they can do is just cry and get
Yeah.
agitated. They cannot tell why they cry, but they are not comfortable because of the eczema that they're having. So it's very poor thing. And that's why I do hope that everyone is aware that eczema is not that uncommon. It's quite common, and there is treatment. Because I have some patient that come to me, the child have eczema so bad, and I say, why you didn't put any treatment until now? So then
Hmm.
the parents will tell me, well, people tell me that, the baby, as they grow up, it will be better. So just leave it lah. So poor thing, the child have no quality sleep, was crying all the time, crying, trying to scratch. And when, every time the baby wake up from sleep, the bed will be stained with blood from all the scratching. So it's very heartbreaking to see such a thing. And,
Yeah.
all this can be treated.
Hmm. Yeah, like you say, like if because they don't know how to tell, because they cannot be telling like daddy, mommy, I've got eczema or I've so but so they really suffer in silence, and then like you said, because they of course they know how to scratch themselves, and then they won't stop, even if it bleeds also they won't stop because they don't
Yeah,
know.
correct.
That is that part lah. I think that part is something which you know uh yeah, you feel it lah, you really feel it lah.
Yeah.
Oh, okay. So, okay, can we take one or two some questions? I show the questions here. Okay. For baby with eczema and during sleep has the habit of sucking their fingers, what can we do to minimize saliva causing eczema getting worse? From Kevin Tan.
Yes. Hi, Kevin. Yeah, you are right that saliva is definitely one of the trigger causing eczema flare. Okay, so then for baby that have the habit of sucking the finger, you will find that the finger, especially the thumb and the
The
index
thumb.
finger, yeah, will have worse eczema if you notice. Yeah. So one thing good about eczema also, if you look carefully at the child that has eczema, every child with eczema have a story to tell one. If you see properly where is the rash, you'll be able to do some detective work and guess what's the possible trigger that is causing the eczema there. Okay, because
Mm,
no point you just putting the treatment without removing the trigger, because here you treat, here
yes.
you trigger, here you treat, here you trigger, you are going nowhere. You are just staying there and you say, ayo, this eczema cannot be treated, I just have to live with it. Okay, so that's why you need to identify the trigger and try to eliminate the trigger. So like for Kevin Tan, you find that the trigger is saliva, which is rightly so. So what you can do to prevent it, I will say that one, you probably can apply moisturizer as a barrier cream on the hand. Okay, so that will be one layer before the saliva in contact with the hand. Okay, you apply a barrier. Second, you can introduce other thing for the child to be comfort, because a lot of time baby just need to, during sleep they need to hold something for comfort, and they
Mm,
can soothe themselves to sleep. They won't be afraid they are holding something of comfort. So you can introduce other thing rather than allowing them to suck on the finger. For example, you can introduce pacifier, you can introduce the comfort toy where they can hold on it. Some baby, they just like the corner of the pillow, they just somehow like to
oh,
hold the corner of the pillow, and that will comfort them to sleep. So you try to introduce other thing in replacement of the finger.
Mm. Yep. So I hope Dr. Jenny answers your question. Yeah, but like you say, all right, Jenny, um, finding the trigger is also very important because there's no point if we don't. I mean, because trigger is the cause. So if we don't find it, every time we treat, we come back, we treat, then the parents will feel that yeah, this eczema cannot be treated. Then they will have that kind of perception. Yeah,
Correct.
but
Then
actually,
they will lose hope and don't bother to treat anymore. So the victim is the baby, the child. Yeah.
but it's also not easy to find the trigger, right? Sometimes, I mean, you really have to investigate. You just have to keep on noticing, lah, right?
That's why every time for a new patient that come and see me for eczema, a lot of time I actually spend half an hour sitting down with them, going through with them, what are the possible trigger, looking at the pattern of rash of the child. A lot of time, I actually point out to them some trigger that they actually didn't even realize, oh, that is the one that is causing my child to have eczema. For example, the commonly now that I see a lot, they have eczema over the buttock there and the thigh, the behind the thigh there. So then a lot of time they didn't realize that the most common trigger to cause eczema flare over that area is actually the toilet seat. Not because the
Oh,
toilet seat is dirty, bear in mind, it's because a lot of
okay.
people like to clean the toilet seat with very strong detergent, Dettol, Clorox,
Oh,
Mr. Muscleman, and this chemical will stick to the plastic of the toilet seat cover. And a lot of people, they like to sit very long in the throne. Sit at the throne there, watching phone, playing phone, iPad, and all that. So then when they
yes,
sit
yes.
so long, all this chemical will stick to their skin. And for sensitive skin, this will trigger a flare of eczema.
Oh, so it's not that the toilet seat is dirty, it's because of all these cleaners that we use to clean it, and oh,
Yes,
it's very strong,
yes,
and your skin is
yes,
sensitive. Wow, I mean,
yes.
this is, see, ladies and gentlemen, we learned something new today. So today's session is very good for all of you. Okay, I think Kevin have a few questions. Yeah. Okay, another question by Kevin. What are your opinion on steroid creams on baby versus Elidel on 5 months old baby? I mean, what is Elidel? Is Elidel another cream? I'm not because I don't know.
Elidel is a non-steroid anti-inflammatory cream.
Oh, okay.
Okay, so anti-inflammatory cream, we got two type. Okay, the steroid and the non-steroid. So,
Hmm.
which one to use? I have to look at the child because one, okay, the choice of which one to use will depend on one, the location, the location of the rash. Okay, for example, those that is around the eyes, the rash that's around the eyes, a lot of time I will choose Elidel. I definitely won't choose a steroid cream around the eyes because if steroid go into the eyes will cause a big problem. And second thing, I will look at the age of the child. 5 months old is a very young child. If possible, I will try to, uh, choose us toward a non-steroid anti-inflammatory cream. But having said so, I have to look at how bad is the rash. If the rash is very bad, very angry looking, very thick, a lot of inflammation is going on, Alida won't work. So I have to use a
Hmm.
steroid cream for a while to bring down the inflammation. When things are under control, I can switch towards the Alidel, which is the non-steroid cream. So all boils down to,
Hmm.
I have to see the child and, tailor
Yeah.
each patient has to have a tailored treatment. It cannot be a generic
Yeah.
treatment for everybody. It don't work that way.
Hmm. Yeah. So like here cannot. It's very difficult to say that definitely Elidel because it's a 5 months old baby because we really have to see different scenarios, different advice. Like you said, maybe I give this because it's so angry looking. So maybe I just start on the steroid maybe just for that 1 2 time first to see whether it works. Then after that, go on. Yeah. So it's very hard to say lah. So every child or every baby that comes in, you have to look at them, you have to assess them. Then only we can decide on what is the best course of action lah.
That's right.
Yeah, I can be a good assistant as well.
Indeed, you can.
Okay, yeah, Kevin have a lot of question. Okay, how accurate are the blood tests and skin prick tests in detecting allergies, especially baby had eczema?
Okay,
How
I'm sure
accurate are they? Yeah. Sorry.
you must be
Yeah.
talking about the allergy test. Okay, the allergy test where we take the blood and test for a panel of a certain number of things. Okay,
Mm.
so allergy tests have to be done very carefully. Okay, I
Oh,
would not advocate everyone with eczema to go for this test. Okay, because
okay.
at the end of the day, it will be very difficult for you to interpret. Okay,
Oh,
so because for this allergy test, you have to couple with a relevant history. For example, mommy come and tell me, doctor, my child every time after eat eggs develop hives. Okay,
okay.
that is a very
Okay.
relevant history. So then I
Okay.
will do a test for these eggs, and voila, it come back positive. So then I can conclude, yes, your child have allergy to eggs. But
Okay.
if let's say someone with eczema and come to me and say, doctor, I think food is the problem. But I don't know what. Every time, my child eats something, 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 he will scratch like mad. So for this, I will be very cautious because eczema
Mm.
itself is itchy. Just that,
Correct.
the perception of the parents, every time they give something that they deem that, oh, this one sure some got problem one. They will watch the child like a hawk like that. The
Oh,
moment the child scratch, they say, this must be the
kidding.
food
Yeah.
causing the eczema. Malaysian, they like to blame it on food. Whereas a lot of time, actually, food is not the culprit. It's
Mm.
more of the environmental trigger. Food, of course, can trigger, but it's one of the lower environmental trigger. It's not the main one, the top one. The top one, a
Oh.
lot of time, is still the environmental trigger. Yeah.
Okay.
So that's why if let's say you have a relevant history, yes, you come to me then say, oh, doctor, I think this food after taking my child does develop hives, the eczema worsen. Then I say, okay, then let's do the test. Okay. But if you blindly, say, doctor, I just want to test everything that you have and see which one is positive. If now I take my own blood and send for the test, I may have a few positive, but that doesn't mean I'm allergic to that thing. It's just that my
Correct.
body, yeah, once upon a time has developed immune tolerance to this thing. So that's why allergy
Mm.
test is have to be careful because I do have parents that come to me and say, doctor, this one my baby at birth the already done the allergy test. I say, why do you do allergy test at birth? Because if the child has not been exposed to anything, all the tests will come back negative. What's the point of you doing an allergy test? That's why
Mm.
allergy tests
Mm.
have to be very interpreted very carefully. Usually, I won't do
Mm.
the allergy test at first visit. A lot of time, I try to look at the child, try to identify the trigger, and point out the trigger to the parents, and ask them to avoid the trigger and put on the appropriate treatment. If let's say the response to the treatment that I put in is not satisfactory, then I say
Okay.
maybe something else is triggering. Let's do an allergy test. Yeah, so it definitely
Mm.
won't be at the first visit.
Mm. Mm. Great, great. Yeah, so it's always trying to find the trigger before we do the allergy test and everything, lah, right? Wow, Kevin is very, very happy. He said, steady, doctor. Right? So, yeah, good that Dr. Jenny managed to, give you some advice. So, the best is bring your child to see her, right? Bring your child to see her, then she can really diagnose and share with you further. So, there's one question on this. What is your doctor's opinion? What is your opinion, doc? Is it safe to get a COVID vaccine for 12 years old with severe peanut allergy? Yeah.
Okay, so
So
when
what do
you
you think?
talk about severe peanut allergy, what do you mean by severe? Okay,
Mm,
so because for COVID vaccine, for those with anaphylaxis, that's the one that we will be careful. But if let's say you say severe peanut allergy is just by after you're taking peanut, you develop some rash and things like that, that is not considered anaphylaxis. Yeah.
maybe there's another question. This one. Okay. My son had eczema until he turns age 10. After that, no more. But he started again with all types of, or I think after he started consuming peanuts lah, then the allergies all came back lah, maybe.
Mm, his nut allergy with all types of peanuts. Okay. Are you confirmed that he has allergy? What happened? If after he taking
Mm,
the peanuts, and you are talking about all sorts of peanut, do you mean the groundnut and the tree nuts?
yeah. So this one also. I mean specifically, of course, we need to know how severe is the peanut allergy lah, right? I mean,
Yes.
or how severe is the allergy? Yeah,
Yes.
because I think she's concerned about giving the child the COVID vaccination lah.
Yeah, if let's say your child have anaphylaxis, yeah, then
Mm,
the doctor, because at every vaccine center there will be a doctor there. The doctor will be very careful if let's say your child has
yeah.
anaphylaxis reaction before. Okay,
Mm,
and but that doesn't mean that he cannot get the vaccine, but he will need to be observed very carefully in a setting that where there is a facility to
yeah.
help your child in case if anything happen after the COVID vaccine. Yeah. So those with anaphylaxis, we will be more careful. But if let's say you just have some sort of rash or some mild allergy, you still can have at the normal center. But after taking the vaccine, you will be monitored longer period compared to someone without allergy.
Yeah, yeah. So just if really the child wants to go and get vaccinated, I think like all this allergy, just declare. I mean, of course, if like Dr. Jenny says, the I don't know what's the term again. It's anaphylaxis. I mean, if you really know whether it is that or not, I think it's best to just tell the PIC, the person in charge there at the
Correct.
vaccination center, so that necessary necessary steps can be done, lah, right?
Yeah, be truthful. Don't hide all this because you say, if I tell later they don't give my child the vaccine. Be truthful because this is for the safety of your child. So you need to declare everything. If any form of allergy is present in your child, you need to declare before getting your child to have the vaccine.
Yeah, true, very true. Okay, yeah, and then oh yeah, Maximus says hi. Yeah, Maximus says hi. Okay.
That's my patient.
Yeah, that's why he says he's coming tomorrow.
Yeah, yeah.
Okay, okay. I think we have some more questions. This is by Felicia. My daughter needs to be scratched every night before bed up to the point when it's red and bleeds, but on some nights she just sleeps with minor or no scratching. Is it an allergy or just a bad habit? Okay.
I will suspect that, there is some form of eczema, sensitive skin there. Otherwise, the child won't be scratching until, it's to the point of red and bleed. So sometimes, there is some flare there that maybe you are not aware of, Felicia. Maybe you should bring your child to be checked because sometimes you may not be aware. A normal child won't be scratching every night and even to the point of being red and bleed.
Yeah, that means of course, if it's, I mean, certain child develop bad habits, but I think what you are trying to mean is also, yeah, I mean, this because this bad habit is so often until it's especially the red, until it's red and it bleeds. So, yeah, suspected there may be an allergy lah. So
Correct.
better go and
Yeah.
consult, someone get checked lah. Yeah, very good, very good. Yeah. So currently, hope everybody have their questions answered. all these are all $1 million questions and $1 million answers. No, actually questions with $1 million answers. Tomorrow you ask, tomorrow you have to pay. Okay. Yeah, I think so. So these are some of the um, questions. Okay. Oh, okay. Yeah, I think Winnie have one question as well. Will the eczema come back years later after they have recovered during baby time? So, I mean, yeah, this is one question I'm very curious also, Jenny. Like, when they are, that means can actually, if a person have eczema, if a child or a baby or infant have eczema, you can actually recover 100% one, is it? Or how does it work actually?
Okay, so that's why a lot of misconception. So if you
Hmm.
have eczema, meaning that genetically you are born with very sensitive and dry skin. Okay,
Okay.
so you are born with that, and your skin actually remains the same even until you adult. But what happened with eczema is a lot of time you have very bad eczema during the first 5 years of life, especially so the first 2 years of life. That's because your immune system, eczema has got to do with the immune system. Your immune system is not matured. Everything can trigger the flare of eczema. But as you grow bigger, after 5 years of age, your immune system stabilize. So not everything that come in contact with your skin will trigger a flare of eczema.
Hmm.
So called that you outgrow the eczema. But actually
Stabilize
your
lah.
skin, yeah, your skin is the same sensitive skin, just that it's not so easily triggered. Until you become
Hmm.
adult, then sometimes you see that, suddenly when you start to wash dishes, you help your parents to wash plates, and then your hand have eczema when you become an adult. Then you say, why my eczema come back, No, it's not that your eczema come back, just that your skin is still sensitive, but it's only now that your immune system is more stable. It's only triggered by very strong chemical, or very strong detergent. It's not every single thing will trigger an eczema flare, but only in
Hmm.
contact with things that is too strong that your skin cannot handle, then you will have the eczema.
Oh, that means in a way it's like as you grow older, you become stronger and everything. Then because your immune system also will be better, so the eczema become dormant lah in a way until something
Yeah, not
triggers
so
it again
easily
lah.
triggered lah. Not
Uh,
so
uh,
easily triggered.
so basically, you went to sleep lah until unless somebody wakes it up again lah.
Yes, you can give that analogy. Very good analogy.
Yeah, I think I mean we are I'm actually enjoying myself so much, and I think we will have to invite you back again lah because now questions I mean answering the questions also like so exciting, you know. Okay, is it okay to take antihistamine on a daily basis for a kid due to eczema? But eczema, do we take antihistamine? Yes, is it?
Yes. Okay. So I do give antihistamine for my kids with eczema, and the choice of antihistamine, I would like something that will help the child to go to sleep. Because like you all say, the child like to scratch a lot, especially at night. Do you know why that happened? Because
Why?
daytime they got a lot of other things to distract their mind. So their mind is not
Oh.
focused on the itch. The itch actually is there, but because they have a lot of things to take away their mind, so they won't think of the itch. But when just before bed,
Mm.
their mind is clear. There's nothing to distract them, and all they can suddenly the itch, intensify. All they can focus on is the itch. So that's why those people with eczema, the scratching will be first before bed. That's why the antihistamine that I give will be a little bit of sedative effect, but it's still a very safe to be given to child if let's say you give the correct dose according to the body weight. So it's okay to
Mm.
take every day, especially during the time that you're trying to put in treatment to control the eczema. But you shouldn't give on and on and on. Once the
Long
treatment
term
take
lah.
effect, yeah, once the treatment take effect, the inflammation come down, the itch come down, and the child can sleep better, that's when you take off this antihistamine. That's why
Mm,
the bottom line is you need to treat the eczema. You cannot just say, just give antihistamine for the itch lah, no need to treat. Cannot. You know, that
mm,
one is just a temporary measure to tie you through the acute phase.
mm. Yeah, like you said, maybe because like daytime, they got so 1,001 things to do, so they don't think about it or it doesn't bother them so much, even though if it's a little bit itchy. But at night when it's all peace and quiet and calm and supposed to sleep, wow, this one really, it it, it magnifies it lah. But like you
Yes,
said, I mean, antihistamine is not for the long term lah. I mean, it's not a
yeah,
long term solution lah. It's always
correct. It should be
trying to
used during the
identify the
acute.
trigger lah.
Mm.
Mm. Yeah, okay. Okay, Ken made a very good statement. That Dr. Jenny kulit cantik berseri, patutlah doktor pakar kulit.
Aiyo.
Okay, Kevin got one more question. He's back. Should we swaddle when babies still haven't rolled over to avoid them from scratching or rubbing their eyes and face? I think this is a
Yes, during the acute phase, okay, where the scratch, because we know that each scratch is also a trigger for eczema flare, which is something that you need to handle. If let's say you just let the child scratch to glory, you again going nowhere, because every time the child scratch, the skin will try to repair themselves and form one layer. Scratch some
correct.
more, form another layer. Scratch some more, form another layer. So it will just be thicker and thicker. So you need to handle each scratch. So swaddling is one of the way. But again, all these are during acute phase. You need to treat and get the inflammation lower, the itchiness lower, and then you can take off all these measures of itch.
Mm, mm. Well, Kevin, I hope you get a very clear answer. I think you had to really have to go and see Dr. Jenny already because your free questions, you have run out of free questions to ask her. Okay. I think we will take one or two more questions, because I mean, I also don't want to take up like too long of your time. Now, this is from your bestie. Does flu meds like Zyrtec, is it effective to ease itchiness? Will there be any side effects for kids, lah? Right? Because we have Zyrtec for adult and Zyrtec for kids as well, right?
Yes, yes. So Zyrtec is a kind of
Mm,
antihistamine. It's an antihistamine that is non-sedative. All right. So if let's
non-sedative.
say you look into the pathway, look into what is the cause that cause itchiness in eczema. They are a
Mm.
lot. Plenty,
Yeah, so
plentiful.
many, right?
So many pathway. And histamine is just one of the many. So when you give antihistamine, does it help with itch? Yes, it does, but it probably just help 10%. Okay, the 90% is still itchy. So it's not a magic treatment. Itchy, give antihistamine. No, it's not like that. So you still need to treat, because if you don't treat the inflammation is the one that is causing the itchiness, and the itch won't go away just by giving Zyrtec. It's not a magic drug. A lot of patients come and tell me, Doctor, I take already this antihistamine. My child is still scratching. I say, yeah, this is not a magic drug. Eventually, this one is just measures putting in to help to reduce the itch. But the most important is you still need to treat to reduce the flare. Once you reduce the flare, the itchiness will come down.
Hmm. Okay. So Miss Shirley Tan, I hope you got your answer. Oh, and then Kevin said he want to ask one more last question before he gets charged. So you say if they are able to roll over and we are not able to swallow them, what is the solution? Since baby have sensitive skin, every time he rub the face will be red. Last question. He put disclaimer already.
If they are able to roll over, and we are not able to swaddle them, okay, so there are a few measures that we can do. Okay, we can apply a moisturizer that contain menthol. So the menthol will leave you have a cooling effect, and the cooling effect will take away the itch. So that's one of the measure.
Oh,
Second measure will be like, sometimes I do introduce for those quite bad eczema, I introduce something called a wet wrap garment. A wet wrap garment where it's damp and the child wear it with a second layer of their pajamas. So then when they have
oh,
it's like it's a very snug clothing that stay close to the skin and it maintain the moisture. At the same time, it's a very soothing to the skin, so that it will reduce the itch. And if let's say the child is still scratching on the skin, it won't cause the broken skin because you have one layer on the skin.
it's called what? Wet.
Wet wrap garment. It's like a
Oh,
pajamas. Yeah, it's like those, like those Uniqlo Arism kind of clothing.
uh,
It's very nice to on the skin, and it's very
but
snug
it's
to the
wet.
skin. Yes, then you wet it before you wear. So the inner layer is wet, the outer layer is dry. So then,
Okay, this is
I told you what happened with eczema is the skin is very, very dry. So by keeping
mm,
the skin moisture, you are actually putting in the treatment already. Moisturizer is very, very important treatment for eczema.
mm,
Mm.
mm. Yeah, very good, very good. Okay, so
Oh,
I
yeah,
think
you just says you.
huh, so yeah, he did. So let doctor rest ready because tomorrow see Doctor Jenny in SJMC. So now better let doctor rest ready, huh? Yeah. So I think maybe I'll just ask you one last question before I let you leave. I mean, of
Mhm.
course, if we wait another 1 2 minutes, there'll be another 4 5 questions. Then you will not be able to get your beauty sleep because you need to rest. To make sure that you know. So I mean now I mean with school reopening and so many things like that, right? So I mean children are now starting to go to school, all right, and of course they have to wear a mask and everything. So what is the right way to wear a mask? How should we wear for them? Because you also know children sometimes where would how would they want to wear masks, right?
Mm. Actually, but you will be surprised, if let's say nowadays I see the kids that come to my clinic, a lot
Ah,
of them are actually wearing their mask properly. And in fact, some of them are wearing the face shield. I'm very impressed because I myself find it very hard to wear the face shield because it's it fog up, it's very stuffy, very difficult to breathe and all those things. But I think all you need to do is just instill it as a habit to them. So what
yeah,
you can do, tips, to how to make your kids wear the mask is one. There are many new interesting masks out there. If you get some cartoon character that they like, they will be very excited and proud to wear it. And in fact, they will ask you for it. Mommy, I want to wear this Pokemon mask, this Hello Kitty mask. So by getting all the interesting masks, they will want to wear it. Especially to girls, they think that it is very pretty. It's become part of the accessory for the girls. For the
yeah,
guys, you get the superhero one, the interesting manly character one, they will wear. So, and how to make them wear better is parents yourself, you have to wear your mask proper. Okay. If let's say your mask is always below the nose or hanging at your below the chin, your child will just learn like you. But if you
yeah,
wear your mask proper, they think that, hey, mommy, daddy is wearing, or I also want to wear. I want to be like them. They always like to be same with the parents. It's part of belonging and they want to copy what the adults do. So if let's say you wear your mask
yeah,
proper, they will wear their mask proper.
yeah. So
Yeah?
I think it's leading by example lah. I mean, yeah, most
Yes,
important thing is
exactly.
lead by example lah.
Correct,
Because
correct. Yeah.
what they see daddy mommy do, they will also do, right?
Yes.
So when,
Yes.
for example, when they see daddy mommy very loving, then they also know, they also must sayang daddy mommy. If they see daddy
Yes,
mommy
that's
not so
very
loving,
true.
then they also will not be so warm. I think so. It's about, doing it. I mean, how we want them to be is not only about us teaching the kids lah. It's about us showing them lah, right? Yeah.
Totally true. Yeah.
Yeah, yeah. So okay, Jenny, Dr. Jenny Tan is actually an hour already. I mean, maybe because the questions are so interesting, chatting. I'm enjoying myself, and usually I don't get to speak to you for 1 hour. Usually maybe 5, 10 minutes, 15 minutes max. So yes, I also maximize my time to speak to you today. Yeah, so I think maybe in future, because of all the questions that our audience is asking, that's why we didn't manage to finish our full coffee talk. So we will have part two soon. That is if Dr. Jenny here is free. I must ask her first. She's a busy woman. Okay. So maybe the part two will be charged already. So because of all the questions, especially Kevin. All right. Yeah. So really, Jenny, thank you very much for coming on board. Doing our coffee talk. I think after this also we will do a lot of sharing of the videos to a lot of our friends, so that they know more that Wisdom is actually a very niche market, but it's also a very very important thing for parents to really consult. To really know, because one thing is not a rash. Is just not a rash. Sometimes it's more than that. Huh? Yeah, so any last words before you say bye bye?
Thanks, Clement, for inviting me. I had a great
Welcome.
time chatting with you here.
Yeah. Okay. So thank you very much. I mean, of course, it's an honor for you to come on board, and I think if given the opportunity and if you have the time, I will invite you again very soon, because parents, they will ask 1,001 question because of the kids lah. Just like how you are a mummy also, sometimes for the kids, I want the best, right? So it's always like
Yes,
that lah.
yes,
Yeah,
yes.
yeah,
Mm.
great, great, great. So thank you very much to Dr. Jenny Tan. So for those who want to ask some more questions, please go and consult her in SJMC, right? You Google, or later after that, or you can PM Kingdom, coffeetalk.kingdomgroup@gmail.com. We will send you all the details. All right. So thank you, Jenny, once again. So I will catch up with you again very soon.
All
Oh,
right, thanks, Clem.
thank you. Okay. Bye-bye.
Bye.
Bye. All right, ladies and gentlemen, there you have it. Dr. Jenny Tan, pediatrician and pediatric dermatologist. So she is a peds doctor, and she is also a pedsdom doctor. Then, like I said, less than 10 pedsdom doctor in Malaysia. So, and I mean, since children's skin condition, or I would not like to say problem, but skin condition or skin complications are now more common, with eczema and all those type of things. If you really need to, please go and consult a pitsdom, because sometimes, like what we mentioned just now, a rash is not just like a rash. It can be other things. And if there's anything at all, of course, giving medicine is good so the child will feel better, but we try to find the trigger, right? So I really hope everybody enjoyed our coffee talk tonight. I mean, I personally, I enjoyed it, speaking to Jenny, because it's been a while, since, I mean, usually I speak to her, I don't speak to her that long, but this is a very good opportunity, and I hope a lot of you have all your questions answered. So yeah, do join us. Thank you for your time, and do join us again for Coffee Talk next Wednesday at 8:30 p.m. Right? So there you have it, Dr. Jenny Tan, Pete's and Pete's them. If you have any questions, or you want to know more about us, or you got any more questions for Dr. Jenny, please email us at this address, coffeetalk.kingdomgroupmy@gmail.com. All right. So I really hope everybody enjoyed our session. You got all your answers to your questions. So I'm looking forward to inviting Dr. Jenny coming back on, maybe for future sessions. If we may do a poll and say who, but I think judging by the response and the questions, yes, everybody enjoyed the session. So I think there you have it. I mean, we Coffee Talk will be ending soon, and Now is still COVID. So even though the market, is starting to open. I mean, when we go out, we see there's traffic jam already. There's crowd building. I urge everyone to stay vigilant and to stay safe, even though the market is slowly opening. But that doesn't mean we have to put our defenses down, lah, right? So in a way, lah, that's what I mean. So just continue to stay vigilant, stay safe, take good care, right? So all I'm going to say is good night, sleep tight, and see you next week. Bye.